With that, I would also like to introduce the speakers of this session, and we have very brilliant speakers for this session. The first speaker is Dr. Afsheen Nasir Gilani. Dr. Afsheen Nasir Gilani is from the batch Ameer-ud-Din Medical College batch A2, and she is working as postdoctoral research scholar as well as co-investigator for women health research at Yale University. She's been there for last 5 years. She produced excellent research articles on cardiothoracic surgery as well as on the women health, and we are very thankful, Dr. Afsheen Nasir, that you join us today. She is joining us online, and it's around 3 a.m. in the United States, and these speakers are joining us. Thank you so much for joining us. The next member of this panel speaker is Dr. Azhar Hussain. Everyone of you mostly know Dr. Azhar Hussain. He is the pioneer of Research Society of Ameer-ud-Din Medical College. He did excellent job. He matched right during his house job. He is currently working as PGY2 in internal medicine at SUNY Upstate Medical University, New York. He's also joining us from the New York, and it's also currently 3 a.m. there, and we are very grateful Dr. Azhar joined us today. Thank you so much, Dr. Azhar. The next member is Hafiz Mohammad Shahzeb. Hafiz Mohammad Shahzeb is from the pioneer batch of Ameer-ud-Din Medical College. He is currently working as PGY4 in neurosurgery, and he produced excellent research. He won number of research award, travel grants, and he will be talking about the research in neurosciences. The next member is Dr. Fatima Saleemi. She is a seasoned researcher at Ameer-ud-Din Medical College, and we are so great to have her. She is so kind, always guiding the juniors regarding the research, the very difficult aspects of it. And over to the next speaker. Thank you so much.
Dr. Afsheen, please continue.
I thought Azhar was going to start, but thank you so much for the opportunity to speak with everyone back home. I am Afsheen. I have been a postdoc at Yale University for about 3 years at this point. I am also a co-investigator and a teaching instructor for women's health and research at Yale. Other than that, I'm a chair for advocacy for Yale Postdoc Association. We are about 1,500 postdocs who are, driving research that is happening at Yale. I also hold leadership positions in Association of Women Surgeons and then also Women in Cardiothoracic Surgery. And I'm truly, truly jazzed to be here to be able to speak on the behalf of research and how my experience is sort of like shaped and given me like all these opportunities for the things that I get to do. Are people able to hear me clearly? Am I audible?
Yes, ma'am.
Oh, perfect. Awesome. So if Azhar wants to go first, please feel free to go because I think that he has like a more generalizable experience because internal medicine is like, a lot of people hope to enter internal medicine. So his experience may be a little bit more generalizable, whereas my experience might be like a little bit more specific to surgery. So if he wants to go first, I wonder if he's there. All right, so I'm going to start because I think I'm not hearing back. Essentially, I think that the way I look at postdoc is that you have to see that, you can't have your both 2 feet, like your feet in like 2 different places. So essentially, you're not a medical student and you're not, you're not a resident. So what is postdocs? Essentially, anyone who's sort of like venturing into research and academia should always question what it would mean to be a postdoc and what they intend to get out of it. For me personally, I would tell a little bit about myself, which is I was a student at Ameer-ud-Din Medical College. And I had this curiosity for the world. Like I just wanted to know more. I wanted to explore more. I didn't feel like, I'm finished. Like I'm not saying that, you do one thing in life, you do like 10, 20, 30 different things that you want to do. So essentially as a student, I came to Cornell as a sub-intern. And then I came here at Yale as a sub-intern again. And so when I came here, the opportune thing in the year 2019 was that in the Yale Integrated Cardiothoracic Surgery program, one of our Pakistani fellows from Karachi had matched, which is like, one of the most prestigious programs. It's Ivy League, it's surgeon scientist pathway. And so somebody connected me with them and they sort of like told me what their path was, and they told me about postdoc, and they told me about research. And I truly think that opportunity begets opportunity. So first, I think my first opportunity was my ability to secure a sub-internship as a student. And then my second opportunity was to be able to network and, sort of like ask the right questions to get the right answers. And I think one thing that truly inspired me even during my sub-internship is that I noted that the future of research, like the future of medicine, like we all practice medicine, you practice medicine, doctors here practice medicine, but how medicine is going to pivot and change over time is truly decided in the rooms that I was as a sub-intern at Yale University. And so I feel like, there were all these, I would say, uh, prostheses or devices that were not even released in the market that they were testing out in the operating rooms. And I was like, wow, what an opportunity to not just practice medicine, but also be able to sort of like contribute to how the specialty is going to evolve over time. So I think that's where I took my inspiration. I truly came here for academic excellence. I don't have any family, so it's like it's kind of like my own little journey of living like a big life. But sort of like speaking more about postdoc and what it means is that, essentially you are a research faculty. You have your own skill set, you have your own line of research, and hopefully, within a year or so, you kind of like get to find your niche. And then you have your own set of students, and you're running everything behind or on the behalf of your professor, but essentially right under the professor, you're the person who's responsible for the research that's happening. And so I feel like it's very important that once you enter a postdoc and you've made a decision that, oh, I truly want to do this, that you also know what it means to do a postdoc. And so it requires a lot of work, a lot of dedication, and a lot of like, soul searching for what excites me, what makes me happy, what keeps me up at night. And for me, it was very straightforward. And I think the people who know me from my time in Ameer-ud-Din Medical College, they know that I'm a big advocate for, equity, especially, women. And so I wanted to work in women's health. And, so much research was coming out at the time that talked about how cardiac diseases in women present very differently compared to cardiac diseases in men. And so management has to be different. So essentially, that was my interest. Now, to make it like, I feel like Azhar should have started it because I still think that, one thing that you should, I feel like because I've done like 3.5 years at this point, so I might be talking about things that, come further down the line. But I think at the time when you're in Pakistan and you're sort of like trying to make a decision whether you want to go into residency, whether you want to do like a very competitive specialty like, surgery, cardiac surgery, neurosurgery, what are the pros and cons of doing a postdoc? So I think that a postdoc, from my personal experience, if I have to do internal medicine, if I have to do psychiatry, I would probably not do a postdoc pathway unless I am very dedicated to becoming a physician scientist, which is a very prestigious position to be in. So of course you can, I would say, always dream as big as you can, and sort of like have the wings and take your flights. Um, but if I were to do internal medicine, I'd probably not invest this much time in a postdoc. So that's one. Because it's time, it's also your skill set, it's also a lot of things. I think truly the pro of research is, well, I've listed like 6 different things, so I'm gonna go over like each one of them one by one. So the first and the foremost thing that you have to see like right in front of you is your CV. And when you think about your CV, think about who you are when you represent yourself on a paper. And so it's one thing to be a postdoc, and it's another thing to have access to all these associations, all these meetings, all these leadership positions, and to be able to navigate those spaces and showing that you can embed in the community but also grow in the community. And so have your CV right in front of you, and there will be your publications, and then there will be your presentations at different conferences. There will be your invited talks at different conferences. And then there will be, what you were able to do on ancillary. Like I have a list of students that I was able to teach things to, and the classes that I took, the invited talks that I gave. And so always I feel like postdocs like a wonderful opportunity to build your CV and to show yourself who you are as as an academic. I think the second thing that I want to note is that when you are in competitive specialties, you have to realize that a lot of conservative specialties are very protective of their tradition. And that protection is also sort of like related to their skepticism of foreign education. So the way you see so many foreign doctors or Pakistani, Indian, South American, you see it in internal medicine, but you won't see them as often in surgeries because surgeries are very closed off spaces. And so the postdoc sort of like gives you an opportunity to show that you're embedded in the community, you're part of their community, and you have invested your time and your resources to develop their work, their research. So that means that you have a degree of ownership. And so I think postdoc gives you like that opportunity, and I will speak like a little bit more about networking, and that's where like a lot of other things come in. And the third thing that I've noted here is, it's a very straightforward path for green card. And I know that that's probably the most lucrative thing about being a postdoc is like, the minute your publications hit a number 10, you get your attorneys on board. And essentially you start your residency on a green card, so which means that you don't have to come every year to get your visa stamped. You don't have to wait until like the end of your residency, do waiver. You have to do like a couple years of waiver on if you do residency on a J1. And I think the visa section is going to talk a little bit more about it. And especially if you're doing surgery, you're investing like a good 5 to 7 years in your training. And doing that much training on a visa is probably not a good idea. I would not recommend if people want to go into surgery to sort of like, visas are a lot of headache. Like right now, I think there's a lot of discussion about how to get visa once you're coming from Pakistan. But the thing is, once you enter the country, there are so many layers to the visa that this is something that's going to hang over you for the next 5-10 years. So postdoc, I think, gives you a very nice opportunity to sort of like have your green card before you start your residency. The fourth thing is that truly the prestige of being a doctor or being a world-class leader in any niche comes from being in research. So everyone practices medicine here, but what truly separates, your line of work and your academic voice and the way you are in the field is how you shape the field for the future. So for example, my work personally is showing that, for example, my niche is cardiac diseases. And so I'm showing that, thoracic aortic aneurysm, it presents late in women, but we essentially, it's not, the notion is that it's presenting late in women, but the truth is we are catching it late. And so women do not have the same access to healthcare as men do. And so that's, where my research is, but also where my advocacy is. And so management has to be different. And sorry, I might be going over the time, so I'll make it short. The fifth thing that I noted here is that you have your own paycheck. If you have to, take your exams, you want to travel, you want to, support your life, your paycheck is the same or sometimes even better than the residents. And so, it's just affordability and your ability to be financially independent. The sixth thing that I've noticed that you travel a lot. Like, for example, I recently just got an invite from a conference in Italy for a talk, and they will sponsor my flights, they will sponsor my hotel. And essentially, every time you're invited to talks, you're traveling globally. I mean, if your visa allows, of course. And it's free. You win travel scholarships. Like next week I'm in Chicago and the week after I'm in Seattle, and I'm able to do all of that because my research, allows me the opportunity to showcase it in different places. So those are like different like benefits that I personally think are associated with a postdoc. one quick thing I wanted to say before giving it over to Azhar is that, there are different career pathways. And today we have gathered here to sort of like talk about how you would pivot into residency after postdoc. But essentially, a postdoc is in and of its own skill set. So if you are somebody who just became a doctor because your parents wanted you to, and you don't want to do USMLE, you don't want to like have to, see patients, it's a great opportunity for you to just be a postdoc, write your own grant, pay yourself, and essentially just become assistant professor. You won't be a clinical professor, but you will be a research professor. You'd still be at a prestigious university. You will escape residency altogether. You will escape patient care altogether. You will escape USMLEs altogether, and you're still an associate professor, sorry, assistant professor who sort of like pays himself and has his own lab. So that's another career pathway from postdoc. And the third pathway apart from residency and being a clinical professor is that you can venture into industry where money is huge, your skill sets very valuable if you go into industry, and life is hopefully more 9 to 5 compared to academia where it can be like really all over the place. So what I'm saying is that postdoc, A, in and of itself is its own skill set. B, it comes with a great amount of benefits. C, you have alternate career pathways. You don't just have to do residency. And D, you really have to make a decision about what specialty you're going into, because as I've said all these things, you must have noted that postdoc is an investment. It's not like a stepping stone. It's a full investment. Like you become a postdoc and then you become other things. So yeah, and then we can talk about like different lines of research, but I feel like right now we don't have enough time, so I'll give it over to Azhar. But thank you so much for this opportunity.
Thank you, Dr. Nasir. Thank you so much for inviting me. I am Azhar Hussain, and I'm currently working as a PGY2, incoming PGY3 in State University of New York, Upstate University Hospital. And I was the member of last pioneer batch. And I appreciate all the support from my mentor from AMC to be make me enabled to be here. So let's talk about something that's is close to my heart, and yep. So I will need somebody to please move my slide. Thank you. Yeah. So getting into the research, especially when you are the intern or you are a medical student, even if we go ahead back in the time. So I think the more important point over here will be to determine why you want to do the research or why you want to involve yourself into the research. So finding that purpose is the key, because it's going to determine what type of research you are going to do, what and how much productivity you will going to have, and then it's going to carry the legacy moving forward. And if you like want to do the research just because you want to add something to your CV, which unfortunately 90% of the IMGs as well as AMGs, American medical graduates, do. They just want to do something. They just want to publish something to have something in the CV, and then they move ahead with that. So if you are truly interested in the research, it's a different level of game, and it's something which is I love the most, and I have been involved in that. So, but let's talk, because we're talking about USMLE career pathways. So we are talking about more of that 90% of the people who just want to add something in their CV and they're not sure how to begin. So the second important question is when to or where should I be, or in which subject I should be doing it. So try to find the area of your interest. Suppose for me, it was gastroenterology and hepatology. I started this journey in when I was MS2, like medical second year of MBBS. And then this will determine who will be your mentor, who will you be working with, and things along that line. So find the area of interest. This will be the second most important thing in this journey. And then when. So many people from Aga Khan and Dow and KE, they start publishing from sometime even like MS1, which is, unfortunately, I think, is not a great practice because you haven't even read the whole human anatomy or human physiology, and you're trying to publish a meta-analysis, which usually their go-to is, I think the program directors over here, the faculty over here, they know it. They have been in this field for over the 30 years most of the time, and they know when it was done, why it was done, and how much a person is passionate about this particular study, about this particular research, and things along that line. And then I would like to bring the most important aspect in this journey, finding the correct research-oriented mentor. I will talk more about in detail. And then this will begin your journey. You will connect with a mentor, and then mentor will guide you, will carry you forward. So next slide, please. So finding a mentor. As I mentioned, it is the most important step in this journey. And it's a tricky situation, especially when you are like medical student 3. This is where when you start looking for a mentor who should be research oriented, who is looking for undergraduate researchers, or you happen to have a conversation while you are on ward rotation during your third year of MBBS or fourth year of MBBS, or even final year of MBBS, and then you happen to learn about their research like enthusiasm, and then you can approach to them. But always think how much passionate they are about this thing, how they are as a mentor from like other people's opinion, or can be a good mentor in your opinion or in your understanding, and then determine like, do your goals align with their goals? Because mentor is not gonna shift the whole thing for you to accommodate you. Like suppose if my mentor is like too involved in third space endoscopy, and I'm gonna talk about like general GA stuff, it's not gonna work. So try to find a mentor whose goal is aligning with your goals. So next slide, please. So how to determine that this mentor will be best for you? So if that person has website, or if that person have a bibliography on PubMed, ResearchGate, or Google Scholar, try to go through their projects, like whatever they have like published, or if they have any website, they are mentioning any ongoing projects, if they seem interesting to you, because this will determine your overall success over long term. Because many projects are started, many people start the projects, but unfortunately they are not completed. And the number one reason being is you lose the interest in the interim. This is important because you want to connect with somebody who is best suited for you and who can guide you and see you like thriving with them as a good mentee. Like if that person comes once in a week and rarely publish anything, and you don't want to connect with them. So how AMC can facilitate, I just wrote it in a small box, because I feel like it's something that Ameer-ud-Din Medical College at that time was liking, that there is no official mentor-mentee program either in basic sciences side or in the clinical sciences side. So in Upstate, in our university program, every resident has an assigned mentor, and one mentor can be can be mentoring more than 10, 12 resident at a time. So this helps a lot in other aspects of the residency training, like how you're doing, going through your evaluation and stuff. But similar thing, I think, can be adopted in AMC as well. First, in the basic side, assign the medical students their mentors. This will help you to navigate their overall performance. At the same time, this will be a potential opportunity for this mentor-mentee process to be initiated. And they can meet biannually or sometime earlier if needed to discuss the overall goals, your interests, and things along that line. Next slide, please. So as we know that most of the mentor that you're going to talk about or you're going to find uh, are very busy, and they are already established and esteemed professionals, which essentially have a limited time. So, and this will be your first contact with them in this whole longitudinal journey. So, what I what I found that's helpful for me is try to email them, even if it's AMC faculty or some other place faculty or in US. Still read about them, learn about them, and then write a nice professional email, and be specific in that email. Mention your goals of why you're contacting them, and then request for a meeting. And when you have the time, when you got the meeting time, be there 15, 20 minutes early. If it's in person or even on Zoom, join 15 minutes, 10 minutes early, and be professional, be courteous. Thank them genuinely for the time, for their interests, and for potential support that you are going to get from them. And then explain them what are your interests, like what are you looking forward from them, how you want to learn from them, and what you have done so far. This will establish a baseline connection between you and the mentor, and then you can start building on this process. And then from here, the mentor will guide you. Okay, I'm working on these projects. I have data in my hand for these projects. You can start working on this. I can help you in this, or I need help in this particular project. If you want to do, help me. So next slide, please. So I will just want to bring up this. If you have primary data, if your mentor has primary data, you can write or you can complete these studies. RCTs or randomized controlled trial are not expected from medical students, and it's something which is also not very common in Pakistan as well. So next slide, please. And the secondary data. So it's something which does not need IRB, and can be done while you are final year of MBBS or at the later part of the fourth year of MBBS when you're done with step one. You can use already published data to summarize it and draw a meaningful conclusion from them. This could be a potential way forward, especially given lack of research trend in Pakistan. Next slide. So unfortunately, still AMC lacking in appropriate research culture. It's not only AMC, it's majority of the medical institutions, academic medical institutions, although they contain research in their motto, in their logo, but research is actually majoritarily missing. So what AMC can do to foster research culture in AMC? We have a small society named Ameer-ud-Din Society of Research. It was established in 2021 under the supervision of uh, Agha Sahab. And then when he retired, mentorship was transferred to Department of Community Medicine, and then it's something we feel like should be encouraged, should be supported. Students should join it, and then students themselves can arrange certain seminars, workshops at the end of the day, or on Friday when you have like uh, half day essentially. So they can train you. You can have some workshops on biostatistics, different statistical softwares, and things along that line. So I think that would be a nice thing. And then we can have basic sciences as well as clinical sciences grand rounds, which can be monthly, bi-monthly, or even bi-weekly, and where you can like invite the STEAM researchers or the STEAM academicians to come and talk. And then we did had annual scientific symposium, but then the COVID hit, and unfortunately that was discontinued for the last 2 years of my like MBBS. So I think it's something that we can resume if not already been resumed. And in that research symposium, we can have an undergraduate research competition that can boost the student morale and give them something to look forward to. And then we can have a research award for best undergraduate who performed really well in the research aspect in the annual convocation. At least you can uh, uh, encourage them in that way that like if somebody's getting distinctions, 5, 10, 20 distinctions is getting acknowledged. But if some person is publishing 20 papers during MBBS, including BMJ and things along that line, but they're not getting recognized, is something we need to look into. And I can give you the example of SUNY Upstate. Uh, at the end of the second year, every year they find the best researcher from that particular batch, and from our batch it was me who was personally nominated. So this gives something to fight for, something to strive for. And it's a very simple thing to add into the convocation. And then there should be an undergraduate corner, although it's above the AMC level, but for the AMC faculty, that in the annual scientific meetings for Boston Society Gastroenterology, Surgicon, or PWSLD, you can have a student corner to just facilitate them, have their separate research competition, and then encourage them. Next slide. Uh, so, so as AMC is majoritarily paper-based, like paper file-based, not to, we do not have a robust EMR system like electronic healthcare record system. So if you want to do any retrospective study, you have to go from files. So there are some other hospitals which are partially at least on EMR-based system where you can like download the data from their system with the help of the faculty after IRB approval, and then publish something. So for me, outside AMC, Gumbel Liver Transplant Center was something that helped me. Dr. Abdul Wahab Dogar is one of the best mentor that I had so far. And you can also reach out to him or any of these facilities who do have at least some sort of EMR, and they can help you in at least some retrospective studies or cross-section studies or cohort studies. Next slide. Although this was the question that was brought up by the audience, so I just want to say that this is the second last slide. Is the research important than USMLE scores? It depends. The answer is it depends where you're applying and what you are looking forward. All programs requires some interest in the research. And it is something, one of the competencies that you need to demonstrate in the residency as well. Then is you have 1 or 2 research projects that have been completed and has been published to like score in this particular competency to graduate. And then if you are applying into certain surgical subspecialties or even general surgery or ENT or ophthalmology in the US, you definitely need research. Without research, there is no way to get into as non-US IMG, especially visa requiring. And if you did only like general internal medicine and now you want to get into a competitive fellowship like gastroenterology, the most competitive fellowship in the general medicine pathway, and then the CARDS, the second most competitive fellowship, the research have been proven to be the most important predictor of the match outcome in this particular population. So I usually see it like USMLE scores determine that you will either match or not. Suppose if you had 214 score in your step to CK, it's very likely that you will not match. It's very likely. I'm not saying like you will not match, but it's very likely you will have a very difficult time matching. But if you have a good score, the research will determine where you're gonna match. Okay, where you're gonna match in a small community program who has been just established with 12 residents, or you wanna match in a good academic institution. And then always focus on the quality, not the quantity, and never let go integrity. Uh, and be mindful, earlier studies are not going to go into BMJ or American College of Gastroenterology journal or anything like that. They will be nice and simple chart-based studies, even case reports. But keep in mind authenticity and integrity. Next. And this is the last slide. Dr. Afsheen Nasir already spoke about the postdoc. So this is an alternative way to land into a match, especially if you have like low scores and your CV is empty. You lack research, but you want to get into something nice or some good program of your choice. Postdoc can help. At the same time, there is another called MPH or Master in Public Health. Uh, uh, it's also something similar to the postdoc, but it's more of like you're pursuing another degree, and it can be 1 year, it can be 2 year, it can be 6 months, but usually they are being offered from Ivy League universities, and they have a good high amount of tuition fee as well. But it's something good to have in the CV, and it definitely can open many doors for you if you have either postdoc or MPH before applying for the match. But be mindful, they can be extra expenditure because postdoc can be unpaid as well. Similarly, MPH has extra expenditure because you are paying the tuition fee to the university to train you or to help you get done with this particular degree. And then there are some, if you are happen to be this last part, the scribe versus physician assistant uh, thing is only applicable who have a valid green card and they don't require visa, but unfortunately or fortunately, they happen to be the medical students from Ameer-ud-Din or from any medical college. Uh, they can like work in the US after getting done with MBBS and having ECFMG valid certificate. In some states, they allow the non-visa requiring foreign medical graduates to have proper like physician assistant jobs, write notes for them, arrange follow-ups, and interpret sometime test results, and then communicate the findings of that particular test with the patient. And then definitely you can gonna get the good LOAs as well like whoever the faculty you're working with, you are working longitudinally with them, 6 months, 1 year, and you can try to work with a particular attending or at a particular university program which does have the residency as well. So it will be a nice thing to boost your chances for the match. So that's pretty much it for me. And thank you so much, everyone. Any questions for me?
Thank you very much, Dr. Azhar.
Hello, Assalamu alaikum. I am Fatima and I just graduated last night and my topic is very concise. अच्छा, अब आप लोगों के लिए यहाँ पे एक बेसिक टिप है कि मेरा जो सेशन है वो सारा का सारा अपॉर्चुनिटी बेस्ड है, तो आप लोग अपने पेन पेपर्स या नोट्स बना लें ताकि जो नेक्स्ट अपॉर्चुनिटीज आई एम गोइंग टू मेंशन आप उनको साथ साथ जैसे जैसे वो आते जाएं आप उनको हिट करते जाएं। सबसे पहले तो एज एन अंडरग्रेड आप रिसर्च कैसे कर सकते हैं, आई जस्ट टेल यू व्हाट आई डिड, ठीक है, ओवर द टाइम। अब लेट्स स्टार्ट। अच्छा, अब मेरा जो सेशन है इसके दो पार्ट्स हैं, हाउ टू बूस्ट योर सीवी, जो कि आई थिंक अ वेरी इंपॉर्टेंट थिंग, बहुत इंपॉर्टेंट बात है एज एन अंडरग्रेड, ठीक है। यहाँ पे हम बहुत सी चीजें जो मिस कर जाते हैं। सबसे पहले आपकी सीवी में 4 चीजें हैं जो बहुत ज्यादा काउंट होंगी, कम्युनिटी वर्क या वॉलेंटियर सर्विसेज, सर्टिफिकेशन, रिसर्च एंड इलेक्टिव्स। अच्छा, लेट्स टॉक अबाउट कम्युनिटी वर्क। कम्युनिटी वर्क में हमारे मेडिकल कैंप्स, जो फंड रेजिंग है, उसके साथ साथ फ्लड रिलीफ प्रोग्राम्स है, ये सब कुछ आ जाता है। कैंपेन्स आ जाती हैं, एजुकेशनल अवेयरनेस कैंपेन्स, और ये बहुत सी सोसाइटीज, बहुत सी एनजीओज हैं जो पोलियो की, डेंगू की, मलेरिया, फ्लड, हर चीज की कर रही होती हैं। सो यू कैन गेट अलॉन्ग विद देम एंड यू कैन डू द कम्युनिटी वर्क जितना मर्जी आप चाहें, एंड दिस इज काउंटेड एंड दिस इज वैल्यूड वेरी मच। नेक्स्ट चीज आ जाती है सर्टिफिकेशन। सर्टिफिकेशन इज सच टास्क जो कि आप जब करते हैं तो उसको आप एक्नॉलेज भी किया जाता है नेशनली, इंटरनेशनली, और उसके बाद आपको इसके एक सर्टिफिकेट दिया जाता है। ना भी दिया जाए एज अ टोकन तो फिर भी आपके पास कुछ पिक्चर्स, कुछ मेमोरीज होती हैं विच यू कैन शो इन योर सीवीज और इन योर लिंक्डइन। उसके बाद आपकी जो है इसकी भी बहुत वर्थ है आपकी सीवी के अंदर। यहाँ पर एक बहुत बड़ी टिप है आप लोगों के लिए कि आप सब लोग जो है अपना सबसे पहले लिंक्डइन अकाउंट बनाएं एज अ मेडिकल स्टूडेंट, ठीक है। उसके बाद उसमें अपनी वर्क प्लेस, अपना कॉलेज वगैरह सब मेंशन करें। वो स्टूडेंट जो रिसर्च कर रहे हैं, रिसर्च में बहुत ज्यादा इंटरेस्टेड है, वो साथ में अपना रिसर्च गेट अकाउंट भी बना लें, ठीक है। जिनकी 1 या 2 पब्लिकेशंस हैं, एलटीज हैं, केस रिपोर्ट्स हैं, कुछ भी है, आप लोग अपना रिसर्च गेट अकाउंट भी बना लें, साथ में अपने लिंक्डइन अकाउंट भी बना लें, ठीक है, ताकि आप लोग अपना जो भी काम है उसको शोकेस करते रहें। दैट्स योर सीवी, दैट्स योर वर्चुअल सीवी एंड दैट काउंट्स अ लॉट। अच्छा, सर्टिफिकेशन में सबसे पहले आ जाती है प्रेजेंटेशन, रिसर्च सिंपोजियम्स वगैरह में। अब यहाँ पे जो बात बहुत इंटरेस्टिंग है वो ये है कि अगर आपका एक आर्टिकल पब्लिश हुआ है या आपने एक आर्टिकल की रिसर्च प्रेजेंटेशन दी है, दे आर इक्वल, ठीक है। आपकी पब्लिकेशन है या आपकी प्रेजेंटेशन है, दे आर समवट इक्वल एंड दे आर वेरी गुड एडिशन इन योर सीवी। उसके बाद आप लेक्चर्स दे सकते हैं, आप यूनिवर्सिटीज में या कहीं पर भी कोई भी अवेयरनेस प्रोग्राम हो रहा है वहाँ लेक्चर दे सकते हैं। आई टेल यू वेरी इंटरेस्टिंग थिंग अबाउट मी। मैं पिछले 3 सालों से ब्रेस्ट कैंसर और यूट्राइन कैंसर की अवेयरनेस प्रोग्राम रन कर रही हूँ, एंड आई एम अ गेस्ट स्पीकर इन मिनहाज यूनिवर्सिटी फॉर द पास्ट 3 years एंड आई हैव दैट मेंशन इन माय लिंक्डइन अकाउंट एज वेल। अच्छा, उसके बाद आ जाते हैं हमारे पास शॉर्ट कोर्सेज। अच्छा, प्रेजेंटेशंस में दिस इज अ वेरी इंपॉर्टेंट थिंग, आपके लिए नोट डाउन करके लाई हूँ। नेशनली हमारे पास 4 से 5 सिंपोजियम्स होते हैं। सबसे पहले हमारे पास शेख जैद का सिंपोजियम है, हर साल हो रहा होता है, आप लोग वहां जाएं, अपनी रिसर्च को प्रेजेंट करें। उसके बाद शिफा इंटरनेशनल का सिंपोजियम है, हर साल होता है। शालामार में पिछले 10 सालों से हो रहा है, 9th सिंपोजियम 1-1.5 हफ्ता पहले। रहबर मेडिकल कॉलेज है, दैट इज एफिलिएटेड विद फौजी फाउंडेशन, वहां पर भी रिसर्च सिंपोजियम्स होते हैं। यू गो एंड यू प्रेजेंट योर सिंपोजियम देयर एंड दे ऑल आर इंटरनेशनली एक्नॉलेज सिंपोजियम्स। इसके बाद इंटरनेशनली नेक्स्ट सिंपोजियम जो है वो जुलाई में आ रहा है, International Society of Stem Cells and Research Symposium. That's an online symposium. You can send in your abstracts and research for publication and for the presentation as well. अच्छा जी, उसके बाद हमारे पास नेक्स्ट जो चीज़ है वो आ जाते हैं वेबिनार्स। वेबिनार्स में आगा खान की वेबिनार्स हैं, हर महीने में 2 या 3 वेबिनार्स हो रहे होते हैं। आप आगा खान की वेबसाइट सब्सक्राइब कर लें, आपके पास आते रहेंगे, ठीक है। शॉर्ट कोर्सेज में आप रेडियोलॉजी का कोर्स कर सकते हैं, आप लोग बायोस्टैट्स का कर सकते हैं, BLS ATLS कर सकते हैं। ऑनलाइन भी कर सकते हैं, किसी डिपार्टमेंट के साथ एफिलिएट होके भी कर सकते हैं, एंड दे आर वेरी वैल्यूएबल। नेक्स्ट चीज जो आ जाती है, वर्कशॉप्स आ जाती हैं। आफान की वर्कशॉप है, ऑनलाइन होती है, हमेशा जूम मीटिंग्स पे होती हैं। उसके बाद इंडस हॉस्पिटल हर साल 2 दफा एक इमरजेंसी मेडिसिन एंड टेक्निक्स पे वर्कशॉप कराता है। दैट्स अ 2 day workshop and that's a very important thing you guys can attend to enhance your skills. Internships. Chuktai Lab offers internships. That's a 1 month internship program, 2 doctors, 2 undergrads, and that's a very valuable addition in your internship. And I have done a lot of things except for internship. मैंने ये सारे चीजें की भी हैं, and these all are add-ons in my CV apart from my graduation. इलेक्टिव्स, इंटरनेशनल इलेक्टिव्स जो है, मैं इनकी बात नहीं करूंगी। मैं सिर्फ पाकिस्तान में जो इलेक्टिव प्रोग्राम्स हैं अवेलेबल हैं, यू कैन डू देम, वो बता दूंगी। शौकत खानम 4th ईयर 5th ईयर के स्टूडेंट्स कर सकते हैं। आखान 4th ईयर 5th ईयर, दे प्रेफर 5th ईयर स्टूडेंट्स। वैसे शिफा इंटरनेशनल के आप कर सकते हैं, एंड दीज आर नेशनली एंड इंटरनेशनली एक्नॉलेज इलेक्टिव्स। उसके अलावा लाहौर में रहते हुए आप पेंस में इलेक्टिव स्टार्ट हो गए लास्ट ईयर से, न्यूरो एंडोवास्कुलर्स में और न्यूरोसर्जरी में। पीआईसी में आप इलेक्टिव्स कर सकते हैं। पीआईसी ऑफर इलेक्टिव्स इन 5 प्रोग्राम्स। शौकत खानम इलेक्टिव ऑफर्स इलेक्टिव्स इन 5 प्रोग्राम्स। उसके बाद चिल्ड्रन हॉस्पिटल है, समर ब्रेक में इलेक्टिव्स कराता है, एंड दे आर वेरी गुड टू एनहांस योर स्किल्स। अच्छा, अब इलेक्टिव्स में आपने क्या करना है, आप इलेक्टिव्स करें, अपनी नेटवर्किंग स्ट्रॉन्ग करें, उसके साथ साथ अपनी स्किल सीखें। स्किल सीखने के बाद आपने अपनी इतनी अच्छी अपनी प्रेजेंटेशन कर लेनी है कि वो आपको हर सूरत लेटर ऑफ रिकमेंडेशन दे। इफ यू आर नॉट गेटिंग अ लेटर ऑफ रिकमेंडेशन, आपकी स्किल्स में इंप्रूव होंगी, बट कहीं ना कुछ रह जाएगा फिर। तो लेटर ऑफ रिकमेंडेशन इज वेरी इंपॉर्टेंट, वो आपने जरूर लेकर आना है जब भी आप करें। अच्छा जी, रिसर्च एट अंडरग्रेड लेवल। रिसर्च एट अंडरग्रेड लेवल जो है, हम 2 तरह से कर सकते हैं रिसर्च। एक तो है एक्सपेरिमेंटल, वी आर नॉट एप्लीकेबल। अंडरग्रेड्स नहीं कर सकते, तो हम आते हैं अपनी डिस्क्रिप्टिव या स्टैटिस्टिकल रिसर्च की तरफ। ठीक है, डिस्क्रिप्टिव में हम केस रिपोर्ट्स कर सकते हैं। हम टर्शरी केयर हॉस्पिटल में बैठे हुए हैं, एंड बिलीव मी गाइज, दिस हॉस्पिटल इज फुल ऑफ रिसर्चेस। आई टेल यू माई एक्सपीरियंस, मैंने फाइनल ईयर के अंदर 7 केस रिपोर्ट्स लिखी हैं, एंड आई सबमिटेड देम ऑल, एंड यू वॉन्ट बिलीव 5 of the case reports from medical unit 3। ठीक है, डॉक्टर फरा सादिक हैं, शी इज अ वेरी गुड प्रोफेशनल, और वो बहुत अच्छी रिसर्चर भी हैं। आप उनको जाके अपना इंटरेस्ट शो कराएं, वो आपको बेतहाशा दे देती हैं। शी गेव मी 5 केस रिपोर्ट्स एंड आई सबमिटेड देम ऑल। थोड़ा डांटेंगी मगर देंगी जरूर। अच्छा, उसके बाद आ जाती है केस सीरीज, दैट्स अ पार्ट ऑफ केस रिपोर्ट एज वेल। स्टैटिस्टिकल डाटा है, क्रॉस सेक्शनल कर सकते हैं, सिस्टमैटिक मेटा एनालिसिस। स्टार्ट फ्रॉम क्रॉस सेक्शंस। अच्छा, रिसर्च के लिए ना, आई मस्ट से यू ओनली नीड 3 थिंग्स। आपके पास या राइटिंग स्किल होनी चाहिए, या आपको एनालिटिकल टूल्स आने चाहिए, इंटरेस्ट होना चाहिए। अब तो खैर रिसर्च एक नेसेसिटी बन गई है, तो आप ना भी इंटरेस्ट शो करें, स्टिल यू नीड इट, और नेटवर्किंग होनी चाहिए। इनमें से कोई एक स्किल भी आपके पास है ना, आपकी रिसर्च हो जाएगी। आप मैन्युस्क्रिप्ट में अच्छे हैं, बहुत से लोग हैं उनको रिसर्च आती है, लिखना नहीं आता, आप उनको मैन्युस्क्रिप्ट राइटिंग करते हैं। आप एनालिसिस में अच्छे हैं, बहुत से लोग होंगे पूरी रिसर्च कर देंगे, उनको उनका एनालिसिस नहीं आ रहा होगा। आपको टूल्स आते हैं, आप उनको एनालिसिस करके दे दें, आपकी भी ऑथरशिप बन जाएगी। इंटरेस्ट है, आप सीखते जाएंगे। नेटवर्किंग स्ट्रांग है, आपको कुछ भी नहीं आता, इफ यू आर गुड एट बिल्डिंग योर नेटवर्क्स, तो आप किसी के पीछे लग लग के सीख ही लेंगे और अपनी रिसर्च और ऑथरशिप्स कर ही लेंगे। अच्छा जी, रिसर्च अपॉर्चुनिटीज, अगेन हमारा हॉस्पिटल टर्शरी के हॉस्पिटल है, हर चीज का डाटा है। ठीक है, केस रिपोर्ट्स बेतहाशा है, केस रिपोर्ट्स हैं, न्यूरोलॉजी में है, पैथोलॉजी में है, सर्जरी में। इवन सर्जरी में भी लास्ट ईयर 2 केस रिपोर्ट थी, हमारे क्लास फेलोज लिख रहे थे। आई डोंट नो उनका क्या बना, बट स्टिल देयर वर। मेडिसिन में बहुत सारी है, ठीक है, आपको बस ढूंढनी है। ठीक है, उसके बाद है म्यूचुअल इंटरेस्ट बनाना है आपने अपना पीजीआर कंसल्टेंट्स के साथ। दिस इज वन ऑफ द बिगेस्ट हैक जो मैंने पूरे फाइनल ईयर में सीखा, वो ये है कि हर पीजी को टू गेट थ्रू इट्स एफसीपीएस एक रिसर्च रिक्वायर्ड है। हर कंसल्टेंट को टू बिकम अ एपी और टू बिकम अ प्रोफेसर कुछ नंबर ऑफ रिसर्चेस रिक्वायर्ड है। तो कितने सारे पीजीज हैं और कितने सारे कंसल्टेंट्स हैं जिनको प्रोफेसर बनना होगा। सो दैट्स अ विन-विन सिचुएशन। आप एक पीजी के पीछे पड़ जाएं तो आपकी भी एक ऑथरशिप हो जाएगी, उनकी भी हो जाएगी। प्रोफेसर के साथ कोलैबोरेट कर लें, आपकी भी ऑथरशिप्स हो जाएंगी, उनकी भी हो जाएंगी। अब रिसर्च इज अ न्यू ट्रेंड, ठीक है, पुराने लोगों को नहीं आता, जो कंसल्टेंट्स बन चुके हैं उनको अब नहीं आती, और क्योंकि वो इतने अपने वर्क में इन्वॉल्व हैं कि वो सीख भी नहीं पा रहे या कुछ नहीं भी ग्रास्प कर पाते, So you are the people who can work from them. आपका भी benefit हो जाएगा, उनका भी benefit हो जाएगा. This is the only way you can learn and you can have your authorships. ठीक है. उसके बाद ये collaborations की बात है, जो seniors हैं या जो research groups हैं उनके साथ collaborate कर ले. कुछ अर्सा, ये जो मैंने लाइन लिखी हुई है, फर्स्ट यू सीक अपॉर्चुनिटीज, लेटर ऑन योर ट्रैक, दिस इज अ रियली इंपॉर्टेंट थिंग. पहले आप हर किसी के पीछे पड़ते हो, मुझे रिसर्च करा दो, मुझे रिसर्च करा दो. लेटर ऑन लोग आपको फोन करेंगे, जी केस रिपोर्ट है, आए लिखते हैं. ठीक है, मेरे साथ होता आ रहा है. आई हैव डन 1 या 2 केस रिपोर्ट्स मैंने न्यूरो कैसे की थी. अब बस मुझे न्यूरो वाले कॉल करते हैं, मैडम केस रिपोर्ट है, आए लिखते हैं, और मैं लिख देती हूँ. सो दैट्स अ विन विन सिचुएशन. यू गाइस कैन हैव दैट टू. अच्छा, उसके बाद अगेन टेक होम मैसेज यही है कि हमारे पास हर चीज है वार्ड में, हर चीज का डेटा, मेडिसिन वार्ड में, नेफ्रो वार्ड में, हर चीज के. आप डीसीएलडी पे डीसीएलडी पे क्रॉस सेक्शंस कर लें, आप जीडीएम पे कर लें, ओपीडी से डाटा लेके कर लें, हर चीज का डाटा मौजूद है. यू जस्ट हैव टू फाइंड इट, sort it, and use it for the best of your interest. And that's from my side. Don't forget to make your LinkedIn accounts, and don't forget to make your ResearchGates account. Okay, Allah Hafiz. And next, if you don't know research, if you don't know any APC, कुछ नहीं आता आपको. I am your senior here. I am a co-founder of International Research Community. That's a platform with more than 50,000 doctors, researchers, professors, and everything, national and international. You can come to IRC any day, any moment, and we are ready to help you. Thank you.
So my name is Dr. Shahzeb Ahmad. I'm a resident of Neurosurgery in the most prestigious institution, one of the most prestigious institution in Pakistan. और मैं पहले बैच से हूँ अमीरुद्दीन मेडिकल कॉलेज के. जब मैंने 4th ईयर फाइनल ईयर में आप लोगों की तरह था, तो मैं भी जाता था, क्योंकि मेरा शुरू से पैशन था कि न्यूरोसर्जरी में मैं जो है ना आगे अपना करियर परसू करूँ. तो मैं जाता था लोगों के पास कि मुझे कोई काम दे दें, कोई रिसर्च दे दें, कुछ भी समझा दें या बता दें, जो भी. आई वॉज सो मच जो है ना पैशनेट के कुछ भी अगर मुझे काम मिलेगा तो मैं करने को तैयार था. बट मुझे कोई काम मिलता नहीं था, कोई देता भी नहीं. तो लोग कहते, रिसर्च कल्चर भी नहीं था उस वक्त. फिर लोग कहते थे कि यार पहले एमबीबीएस तो कर लो, हाउस जॉब तो कर लो, ट्रेनिंग में आ जाओ. रिसर्च काहे की रिसर्च, कौन सी रिसर्च, देखो इसको ये कहाँ पे रिसर्च कर, ऐसे ऐसी चीजें सुनने को मिलती थी. तो काफी डिस्करेज हो जाता था बंदा. लेकिन अब आप लोगों में जो जिस तरह का अल्हम्दुलिल्लाह हमारा ये कल्चर अब डेवलप हो रहा है और हो गया है, और उसके साथ साथ चलते मैं अपनी तरफ से ये रिक्वेस्ट करना चाहता हूँ आप तमाम स्टूडेंट्स को, जो भी न्यूरोसर्जरी के रिसर्च में अगर इंटरेस्टेड हैं, तो उनके लिए हम, चूंकि हम एक ऐसे इंस्टीट्यूशन में काम कर रहे हैं जहाँ पे बहुत ज़्यादा डाटा अवेलेबल है, बहुत ज़्यादा पेशेंट का इन्फ्लक्स है. इतना तो मतलब अमेरिका से मेरे वार्ड में एक अभी जेम्स करके एक मेडिकल स्कूल में पढ़ता है, फाइनल ईयर का उनका वो है, स्टूडेंट है, वो रोटेट होने के लिए आया हुआ है. और वो देख के लोग जो है कहीं भी अमेरिका से मेरे प्रोफेसर साहब बुलाते रहते हैं लोगों को. तो वो हमसे जब मिलते हैं तो वो कहते हैं कि इतना पेशेंट और इतना डाटा और इतना सारा, लेकिन अनफॉर्चुनेटली हमारे पास डाटा बेसिस नहीं है, हमारे पास ऑर्गेनाइज डाटा नहीं होता. गवर्नमेंट लेवल पे कोई, जिस तरह अभी अजहर ने बताया था कि ईएमआर सिस्टम नहीं होते, और हमारे पास रिट्रोस्पेक्टिव एनालिसिस, लेकिन फिर भी किसी किस्म का हमारा लोकल एक पैक्स का सिस्टम यहाँ पे मौजूद है. तो फॉर्चुनेटली वो भी अल्हम्दुलिल्लाह डेवलप किया गयासुन नबी तैयब साहब ने. और उसके अलावा उसके ऊपर हम काम कर सकते हैं, डाटा कलेक्ट कर सकते हैं. उसमें रिसर्चेज जो मेंटर मेंटी वाला जो सिस्टम है अभी, वो भी इंशाल्लाह शुरू होगा, अभी सेशन भी उसका आएगा. तो हम ये चाहते हैं कि हम जो भी पुट फॉरवर्ड कर सकें आप लोगों के लिए, तो आप जो है उसको उसमें आके हमें ज्वाइन करिए और न्यूरोसर्जरी की रिसर्च के अंदर, तो फिर हम आगे थोड़ा सा काम करेंगे. भाई अगली स्लाइड करना. तो आप में से कोई है न्यूरोसर्जरी की रिसर्च में या उसमें काम करने में इंटरेस्टेड, तो काइंडली रेज योर हैंड्स. चलो ठीक है, इतने भी बहुत हैं माशाल्लाह. तो हमारे हमने पिछले कुछ एक दो सालों में हमने कुछ ओरिजिनल आर्टिकल पब्लिश किए, फिर कुछ प्रोजेक्ट्स हुए, फिर हमें कुछ अवार्ड्स वगैरह मिले, इंटरनेशनल हमने ट्रैवल किया, ये वो सब, वो तो सारा चलता ही रहता है, रिसर्च का पार्ट ही। अगली स्लाइड कर दो भाई। तो हम अभी जो हमारे एक्टिव प्रोजेक्ट्स हैं उसके लिए हम रिक्वेस्ट कर रहे हैं जिनके लिए कि लोग आके हमें ज्वाइन करें। तो वो है एक ऑर्गेनाइजेशनल कोहॉर्ट है, गौर से ज़रा सुन लीजिएगा। जेनेटिक्स, एपिजेनेटिक्स एंड ट्रांसक्रिप्टोमिक्स, जो हमारी मैडम हैं डॉक्टर गजाला रूबी, उनके साथ हमने कोलैबोरेट किया था। फिर हमारा हमने कोई जमन भी एक वो हमारे प्रोफेसर साहब हैं अहमद नासिर साहब, उन्होंने जमन एक लैब से कोलैबोरेट किया। तो हम ये प्रोजेक्ट करने की कोशिश कर रहे हैं कि हमारे मुल्क में बहुत लेट प्रेजेंट होते हैं ग्लायोमा, यानी ब्रेन ट्यूमर जो है, ब्रेन ट्यूमर इतना लेट प्रेजेंट होता है, उसको अर्ली डिटेक्शन के लिए हम कोई स्क्रीनिंग टूल जो है वो डिवाइस कर सकें जो ब्लड मार्कर हो, उसको ढूंढने की कोशिश कर रहे हैं। डायरेक्शनल वर्सेस नॉन डायरेक्शनल लीड, ये हमारा डीप ब्रेन स्टिमुलेशन, बेसिकली मेरे प्रोफेसर साहब जो हैं प्रोफेसर आसिफ बशीर, तो वो डीबीएस करते हैं बहुत ज़्यादा। अभी तो हम लीजनिंग और दूसरे प्रोसीजर भी स्टार्ट कर लिए हमने, फॉर डिस्टोनिया, फॉर वेगल नर्व स्टिमुलेशन, उस तरह के प्रोसीजर भी कर रहे हैं। लेकिन ज़्यादातर हमारा डाटा जो पार्किंसन के ऊपर है, इसमें मेरा एक पहले आर्टिकल पब्लिश हुआ है, effect of drug subthalamic nucleus deep brain stimulation in terms of drug reduction and बाकी जो उसके मोटर सिम्टम्स होते हैं UPDRS 3 और 4 वगैरह। तो अभी हम डायरेक्शनल वर्सेस नॉन डायरेक्शनल पे भी काम कर रहे हैं। और फिर जो है कुछ स्पाइन के प्रोजेक्ट्स हैं, ये आपके सामने हैं। ठीक है, अगली स्लाइड कर दो भाई। और ये भी हमारे प्रोजेक्ट्स हैं। एक इंटरेस्टिंग चीज मैं आपको बताता हूँ। एक मिसूरी से आए थे चेयर, न्यूरोसर्जरी के चेयर हैं, तो उनके साथ प्रोग्राम डायरेक्टर भी थे। तो हमारे थिएटर में वॉशअप हुए, उन्होंने एक एनोरिज्म क्लिप करने की कोशिश की। तो वो जो एनोरिज्म वहाँ पे उनके उनके पास ज़्यादातर जो एनोरिज्म डायग्नोज होते हैं वो स्क्रीनिंग के दौरान हो जाते हैं। मतलब कोई किसी वजह से एंजियोग्राफी करा रहा था या कुछ और कर रहा था, तो उसको वहाँ पे एनोरिज्म मिल गया। तो वो वाले जो होते हैं उनको फिर वो इलेक्टिवली ऑपरेट करते हैं। तो उनके पास ब्रेन जो होता है वो इतना ज्यादा एंग्री नहीं होता, इतना स्वोलन नहीं होता जिस तरह के हमारे पास प्रेजेंट करते हैं। हमारे पास पेशेंट पहले जो है वो रप्चर होता है एनोरिज्म उसका, और वो फिर अल्टर स्टेट ऑफ कॉन्शियसनेस में जाता है, 4-5 दिन वहां रहता है, फिर वो वेट पीरियड गुजारता है, फिर वो बाहर आता है, और उसके दौरान हम प्लान करके उसको ऑपरेट करते हैं। तो हमारा थिएटर में वो केस ओपन था। तो इतना एंग्री ब्रेन था की होल क्रेनियोटमी छोटी सी यहाँ से करके करते हैं या फिर यहाँ से टिरियन से करते हैं। तो छोटी सी क्रेनियोटमी से जब वो खोलते हैं, ब्रेन आगे जगह ही नहीं देता, ब्रेन को रिट्रैक्ट करना पड़ता है उसको एनोरिज्म को अंदर सर्कोविलस तक जाने के लिए। तो वो फिर खत्म करने लगे। और फिर क्या होता है कि वो हमने हमारे एक SR हैं, AP हैं, उन्होंने वो उसको क्या किया, पर ऑपरेटिव टैप कर लिया। यानी कि उसके अंदर ना एक समझ लो शंट डाल दिया उसको, और पर ऑपरेटिव टैप किया तो वेंटिकल ड्रेन करके, तो वो फिर ब्रेन बैठ गया, उसके बाद उनको डाल दिया। तो बड़ी आसानी से उन्होंने एनोरिज्म क्लिप कर लिया अल्हम्दुलिल्लाह। तो हमारे जो स्किल लेवल है, जो एक्सपर्टीज हैं, जैसे मियां साहब कह रहे थे, हमें अपने आप को क्रेडिट देना चाहिए, बहुत अच्छा है अल्हम्दुलिल्लाह। और उसके साथ साथ हमें जो अवेलेबल डाटा है उसमें रिसर्च प्रोजेक्ट्स करके अच्छे तरीके से ऑर्गेनाइज करके अपने आप को अच्छे तरीके से प्रेजेंट करना चाहिए इंटरनेशनली। तो मेरी आप तमाम भाइयों से, जूनियर से रिक्वेस्ट है कि हमारे साथ इसमें आएंगे। तो वो जमील भाई हमारे SR हैं, और फिर डॉक्टर उसामा मंसूर हैं, तो वो सारे काम करते हैं इसमें। जैसे वो, हाँ, ये वाली स्लाइड में ये है कि जैसे वो कह रहे थे ना, डॉक्टर अजहर ने बहुत अच्छी प्रेजेंटेशन दी। तो वो कह रहे थे कि हम बाई एनुअल मीटिंग्स रख सकते हैं, हम वो अपना आगा साहब सिंपोजियम कराते होते थे, आगा साहब का सिंपोजियम रिज्यूम कर सकते हैं। और इस पे हम काम करेंगे इंशाल्लाह, जैसे फराज वगैरह सारे लगे हुए हैं। और उसके अलावा हाँ, हम वो वर्कशॉप्स भी करा सकते हैं। अगर जो लोग आप जैसे विलिंग होंगे, जो जिस तरीके से आपके अंदर एंथुसिज्म होगा, जितना ज़्यादा चलता है, तो वैसे स्टूडेंट्स में होता ही है, तो उनको वो आगे रास्ता नहीं मिलता। तो हम आपके लिए एक रास्ता हैं, अगर आप समझें तो। अगर आप हमें भी आपसे जो है अ, खुशी की होगी आपके साथ काम करने के लिए। थैंक यू सो मच, आपके टाइम के लिए बहुत शुक्रिया।